Welcome back. As COVID cases surge and then pull back and then surge again, it's putting a strain on our healthcare workers on the front line. Joining us now is Dr. Testa, Chief Medical Officer at Dignity Health here in Southern California. First off, good morning, Dr. Testa.
Good morning, Phil.
Now let's talk about the healthcare workers. I think when we think about it, we know that they're at risk. But with this increase of cases over the last 4 months, have we seen healthcare workers getting more infected or about the same?
So there's no great database that tracks the number of infected healthcare workers. CDPH released a brief earlier in July saying that we had 16,000 infected healthcare workers and over 100 deaths in California. There is one database that tracks confirmed healthcare workers who have died from COVID-19. I checked it today in preparation for this. There were 821 healthcare workers who have succumbed to COVID-19. When I checked it last week, that number was in the mid-sixes. So as we're seeing this surge throughout the country, there's a surge in healthcare workers who are succumbing to this disease too. As I looked, there was one healthcare worker who was a nursing assistant, who was 20 years old. These are not 60, 70, 80-year-old individuals. These are young people who are in the prime of their life who are helping to fight this disease, who are dying of it.
Now, we're talking about a 20-year-old. That's probably a college student. And that is also a group of people that we're really worried about getting the virus because, no knock on our younger generation, they're more willing to move around. Maybe they're asymptomatic. Do you find that to be concerning?
Of course. I think that with youth, there comes perception of invincibility. And I think also with youth, particularly those in school age, this is a very frustrating time. You know, we've all watched our children, those of us who are parents, have to miss graduations. And, you know, I think that sense or perception of invincibility connected to that sense of loss of part of your youth is having people say, listen, I'm just going to risk it and get out there and, you know, go do what I was doing before and socialize with my friends. And, you know, this is the exact time we have to stop doing that. And we have to think about what is our role in society as a whole.
You also talked about, you know, go back to that death rate, which is just such a horrible statistic. You almost see a kind of a spike in the death rate among healthcare workers. Now, we're going into our 4th month here. People in general are getting out because they're tired of staying home, burning out on this virus. When you talk about healthcare worker burnout, they have the same feelings that we have, but they're still right there in the front of it. They can't let their guard down.
Right. Yeah. And healthcare burnout is interesting. It was a burning platform before COVID-19. You know, if you look at some of the literature that was out there, we were seeing upwards of 40% of nurses, physicians, paramedics showing signs of burnout. Something interesting happened when COVID-19 occurred, which was this galvanizing moment where society turned to physicians and nurses to say, how are we going to get through this? And hospitals really put everything else aside to say, this is all we're going to work on. We're going to focus on this. We're going to be a team. And I'm going to tell you what, initially, I saw an esprit de corps that I'd never seen in hospitals, where I would say some of that burnout actually vanished. People felt like a singular purpose that we're going to work together. But now what we're seeing is that wearing a mask is being politicized. Healthcare professionals who are getting up there are saying what they think should happen, and people are questioning them based on political views. And I'm going to tell you what, that's now once again undermining the spirit of those healthcare workers and really pushing burnout to the front. So what I think actually started as a united movement among healthcare workers, people are now really starting to feel burned out again.
In 15 seconds or less, what can we do to help? Just pat them on the back, say thanks periodically?
The thanks are appreciated. Listen to science, okay? And accept sometimes Dr. Fauci or another scientist is going to get up there and say something, and he's going to change his position a week later because that's what happens in science. But listen to science and keep thinking further than just ourselves. Think about our whole community and how we can influence our whole community by protecting everyone.
And we also have to remember, this is a new virus, and we're learning new stuff every single day. Dr. Testa, thank you very much. Chief Medical Officer with Dignity Health, Southern California. Hope you have a great weekend. We'll see you next week.
You too, Phil.
Okay.
Be safe.
When we